Hello, I did my bachelor thesis in medical informatics on the topic of cough detection using artificial intelligence. With cough as a key symptom of many respiratory diseases, there are multiple reasons why automatic cough detection using artificial intelligence is important. Chronic cough affects as much as 10% of the world population and as such the life quality negatively. Cough frequency is a measurement tool for the well-being of such affected individuals and might be measured during treatment. Cough frequency is also an important research tool and could be used in the monitoring of patients or in models estimating the transmission of airborne diseases. Traditional studies often use a microphone close to the source of the cough, with little to no background noise. The data gathered in this thesis, however, uses a single microphone in the waiting room of a primary care facility with various levels of background noise. Different artificial intelligence models were trained to detect noise and to detect cough. Another series of models were trained to recognize coughs with mask and without mask. The results show high accuracy values for both specificity, sensitivity, using one of the trained models. Coughs with mask were also recognized at high accuracy. With this, cough detection using artificial intelligence has been shown to be feasible. Hopefully, medical informatics can improve the quality of life for many people in the future, a future in which humanity and any form of intelligence can work towards together.